Rolling, everybody rolling? Everybody ready? Just ignore the camera, obviously. And just so we have it on the tape, we always do this. Give us your full name, spell it, so we have it spelled correctly.
It's Kenneth B. Schwartz, S-C-H-W-A-R-T-Z.
I'm going to start this way by asking, do you remember the first time you met Dr. Lynch?
He was up against this beast, and there wasn't, from his point of view, it seemed like there wasn't enough time in the day to keep up with the cancer beast. He had some of the intensity and the ferocity of the beast he was facing. So it didn't make me uncomfortable. It made me feel that this was a guy who took this monster seriously. After all of the high-dose chemotherapy and radiation, I still had a spread of the cancer to my spine, a so-called metastatic tumor. I looked at him and I said, how do you do this job? And he said, by praying I don't have days like today. And he said, we don't have a cure at this time for this condition that you're in, which was hard for my wife and me to hear. I said, are you going to fight with me to the end? Because I'm not going gently into that good night. And he said, absolutely. And that touched me, and it made my wife and me feel that he had regained his own sense of hope, which helped fuel our regaining of hope.
In my career, I've been fortunate to do a number of different things. I was involved in helping find some new treatments for patients with lung cancer. I've been involved in starting a cancer hospital, the Smilo Cancer Hospital in New Haven. Yet, when I look at all the things in my career, Ken Schwartz had enormous impact. I've never been moved like I was by the eulogies at Ken's funeral. He clearly had touched people in a way that he was not going to be forgotten.
Let's talk about Mimi for a minute.
Okay.
I see the smile come to your face. Well, why do you smile when I just mentioned her name?
I just think Mimi is incredible. The best example was, she said, and I actually started to tear up. She said, you know, we're going to stick by you to the end. She said, we're going to stick by you, we're going to hang in there, no matter what the results of the scan are. And she gave me a hug. I mean, it's just an example of her going beyond the usual, more distant professional style to comfort me at a tough time. And that was just representative of sort of her style.
Ken was an amazing person. He was so easy to talk to. He wasn't afraid to talk about some of the difficult issues. He really wanted to make sure that every patient from every walk of life had that same level of care that he felt he had received.
Recognizing compassionate healthcare when it occurs has a very big impact to role model that for younger physicians, and not only for younger physicians, for established doctors, nurses, social workers, to be able to see the importance of compassion and to show that it's valued at the very highest level, that you care about what you're doing for your patients.
Tonight's invitation asks us to celebrate the power of the smallest gesture. I love this expression because it captures how little details have the capacity to transform experience.
I thank the Schwartz Center not only for this award, but also for their 20 years of promoting compassion as the very heart of healthcare. I think the Schwartz Center is successful mainly because its mission connects with what's in all of us. We all want to help those who suffer, and we all need to help those who need to feel the healing power of love.
Love is at the core of all human beings. The mother of a sick child knows all too well the power of love in healing. Shouldn't we, as healers, show the same love to others? Love is to share the patient's worries and reassure them that we, as a team, care.
I try to share all my heart with my patients, knowing that one day I will be in the same situation. I listen, I speak very softly, I don't rush.
Our essential ingredient is a listening ear in a quiet, safe, tranquil, and soothing environment. Listening is our most powerful tool, and we listen to tears when there are no words.
Each of the nominees tonight is exceptional in their approach, in their compassion, in their understanding of the need to generously listen. What we need is for all of medicine to be all of those things all of the time.
I believe that every caregiver can utter that kind word, that reassuring, sometimes healing touch, and make the difference. It made the difference, a big difference in Ken Schwartz's life.